Starting today, nearly 2 million seniors are eligible for coverage under the Canadian Dental Plan. People over the age of 70 can get their health care services covered by the program, and for some, it's been a while since their last appointment.
The dentist is expensive, so is why I wait till the problem was very bad. Take a look at your teeth.
Seniors aged 65 to 69 are also able to sign up online. The federal government is rolling out the program gradually to eventually cover 1/4 of Canadians who don't have private dental plans. Dentists have generally supported a national dental insurance program, but some have been reluctant to register for this one so far. They're citing concerns about additional paperwork and signing contracts to provide care. My next guest is one of the dentists who has not signed on to the plan. Dr. Joel Antel is the president of the Canadian Dental Association, and that association represents dentists across the country. Dr. Antel is also a practicing dentist, and he joins us now from Winnipeg. Welcome.
Thanks for having me.
Dr. Antel, why are you not signing on to this plan?
Like many of the dentists that aren't signed up at this point, I'm looking forward to being able to sign up and start having these patients get the care that they need that there have been obstacles to in the past. But there's a lot of the details of this plan that have yet to be decided, and it's very hard to sign into something that's open-ended and still not complete. So hopefully that process will be finished very quickly so we can go ahead and get started signing up and taking part.
Do you have any main concerns, or what are the main concerns of your members who have decided, not yet, I'm not ready to sign on to this?
The main concern right now is how different this is from conventional dental insurance. To sign on to this plan, we sign up to a very complex technical detail of terms and conditions that are not consistent with the smooth running of the dental office. So besides taking on patients that increase the workload, it decreases our ability to do the clinical work because we have to take people away to handle that additional clerical time.
The truth is that some dentists have actually signed up, but a relatively small number compared to how many could. Why have those who've decided to sign on with it? What's your understanding as to why they've done it?
I really don't have the answer to that. I would assume they just either feel that they're comfortable with the current terms and conditions, or they're just not aware of the terms and conditions and have signed on blindly. But how many have done either of those, I just don't have that answer.
What about the patients? On the surface, this plan, it's one that it covers dental, but not everything is covered. And I'm wondering, patients, when they come in and they learn about what is not going to be covered here, how do they respond when they find that out?
One of the other big administrative burdens that we're dealing with in this plan is that how much misinformation is out there. So people are coming in, and we're the deliverers of the bad news because their understanding is that they're going to have the care that is appropriate for them, and it's going to be free. When in fact, what this plan is offering is a subsidy towards the care that they need. If they only get treated under the plan, there's a list of procedures that may or may not serve their needs, and it's only going to pay part of the cost. So we're the ones that have to let them know that, explain it in depth, and again, take staff or dentists away from clinical work to have those conversations.
From the sounds of what you're saying, you don't appreciate having to be the bearer of bad news. What do you make of the rollout of this plan?
I think it is to the government's credit that they've got some part of this plan going as fast as they have. This is a giant plan that should take years to plan, and they've got it rolling pretty quickly. So I have to commend them for that. It's just unfortunate that the two parts, getting the patients to register and getting the details finalized that would allow the practitioners to take part, didn't coordinate on the same day. Hopefully we're going to see that very soon, and that's not going to be a long-term thing that requires a lot of time to fix.
The federal minister, Mark Holland, was asked today about your criticisms of this plan. I want to play a clip here. This is how he responded.
Look, it's time to offer service. I have worked with the dental associations in good faith, worked through all of their issues. This couldn't be any simpler. It works just like any other insurance plan does. You bring your identity card with you, you put it into the same computer system that they use for every other form of insurance, and then they get paid in 2 days.
Okay, so he says he's worked in good faith. This couldn't be any simpler. What do you make of that response?
There are some serious disconnects between his description of how simple this is and how actually complex and how different from conventional insurance this is. We've been working with the minister. We've had really good conversations behind the scenes. I don't think it's appropriate for us to work together out in the public where people have to posture. Behind the scenes, this is actually going quite well. We just have to keep working on it to get it to a conclusion.
So as the president of this association, you represent dentists across the country. You say you hope they're going to get there. What is it you would like to see here?
If they could make this like conventional dental insurance so that it fit in with the current operations of dental offices without requiring additional administrative time, additional administrative staff, and changes to how our offices operate, as well as make sure that the patients have complete and accurate information about what they will be getting under this plan and what they won't be getting under this plan, I think we're there. That's very simple for me to say, just as it was very simple for the minister to say what he said. I think both of these are very much more complex behind the scenes, and that's what we're working on.
Dr. Joel Antel is the president of the Canadian Dental Association. Really appreciate your time tonight. Thank you.
Thanks for having me. I appreciate the opportunity.